As many of you know, a number of federal cases have been brought against the United States government regarding what's come to be known as the Affordable Care Act. And as a result of these federal cases, the Supreme Court of the United States actually decided to hear arguments around the constitutionality of the legislation. Now, in June of 2012, it's expected that the Supreme Court will deliver its decision on issues around the Affordable Care Act and its constitutionality. So we are anticipating a decision to be communicated to the general public within the next week. And in advance of that, I wanted to give our perspective on what the law means to us as it stands. So as many of you know, LIVESTRONG originally supported healthcare reform as it was proposed, and that was largely because it was aligned with a set of principles that we developed back in 2009 around healthcare reform and what any legislation should include. And so we were really happy to see the provisions that were put in place in the new law. And more importantly, 2.5 years later since its enactment, we've been able to see the law in action and really have been able to witness the benefits of the law for the people we serve. We in particular have been able to employ tenets of the law when serving people through our LiveStrong Cancer Navigation Center. And so I think for us, the bottom line is not about politics, and it's certainly not about popularity, but it's about it being a priority for people living with cancer. People living with cancer need to have access to healthcare and essential healthcare services. What they don't need are caps on annual and lifetime insurance spending. We need young adults who have access to care up until the age 26. We need people to have access to preventive healthcare services, in particular diagnostics for cancer, without them being cost prohibitive. So these are just examples of some of the provisions that we've supported within the law and that we really are hoping are upheld in any decision. We definitely applaud leaders in industry, such as United Healthcare, that have really taken a stand to say, regardless of what the Supreme Court says this month, they will be upholding some of the provisions of the law. And again, we at LiveStrong will be working with other leaders within industry or at the state level and otherwise communicating the importance of those tenets, again, in a way that best serves and protects people living with cancer. So that's our current take on healthcare reform as it stands today, and stay tuned for more updates from us, in particular as we hear more from the Supreme Court. Live strong.